I am so excited, Edie Edens from KLF, to be joining you with a fellow subject matter expert and dear friend and colleague, Helen Maurer. Helen, welcome. Thank you so much for joining us for a couple of sessions.
Thank you so much for having me.
Yeah, absolutely. Helen, why don't you give the audience just one or two little tidbits about yourself and your experience in the industry, and then we'll dive right into our topic.
Sure, absolutely. So I've been in the clinical space for about 15 years, primarily focusing on quality assurance and compliance in the oncology space. And I'm excited to be here.
The first area that I want to explore with you is data privacy and security as it relates to healthcare data. To understand if I'm at a major academic medical center, or I'm at a major healthcare research hub, and I receive federal funding, and I have someone approach me about wanting to look at data or information that I otherwise would object to sharing based on privacy rules, regulations, policies, best practices, no matter where you are, what do I do in the United States? So let's start with, do you think this is something that could happen, Helen? Are we crazy for talking about it, or are we in a new world with a new administration that has new ideas?
I think given the space that we are now in and what we're living on a day to day, anything's possible. So I
Yeah.
think it's definitely important for us to be thinking about it and talking about it. I think it also depends on if it's at the federal level or the state level. If you're in an academic medical center, and you have someone approach your clinical trials office about accessing data that otherwise would fall under privacy regulation, hold to that privacy regulation, operate as your data on your day-to-day, just like you have been, and just continue to protect your participant data. There's something that
Right.
there's a shift in in the process that we have to abide by. And also
I
at the state level too.
And for those that may not understand this, and many of you probably already do, but just so you know, federal authority can at times override state authority. Not always, but sometimes. But federal overriding federal is a much more difficult proposition. And so this is when we say it's important to know how your clinical trial participants' data is protected. That's why it's important to know if whatever regulations you're using, whatever policies you have are tied to a state or federal regulation. Because if you did wind up in this scenario and you had to push back, you're going to want to know which is more powerful based on that information. Can you imagine a scenario here where this happens, where this plays out, where, the clinical trials office at a major cancer center gets a call? And the other thought I have on that is, what would be the value in this data for the federal government? Why would they want to overstep? I mean, for me, I don't see a reason, but I also probably am not thinking, the same train of thought. I don't work at the federal government. I'm not trying to pretend like I, can do their job. What do you think would be the value? Where would be the proposition?
I don't think there would be any value for that, to be honest.
But what about with RFK getting confirmed? Like, let's think about it from the perspective of, we have a lot of arguments about preventative health management. So maybe they want a data set to show where preventative health would have helped better, or where something could have been prevented, maybe.
So long as it's de-identified and read and available for, distribution
And that
according.
individual consented to having their
And
data
that
actually
and
shared.
that's yep, absolutely. And that's really one of the most key points is
Yeah,
the participants' agreement to, allow their data to be shared within a certain environment and to certain
right.
people. And being approached by potential, you know, having
Non-healthcare providers, right? Like people are not related to your
exactly
care intimately, we'll say.
right, exactly. So I think that there's, it's possible that we could get there, but it's how do you handle it when it
Yeah.
happens?
Yeah, absolutely. And I think now we're just at a point where it's not like we want to throw out far-fetched conspiracies or strike fear in anyone's heart. Rather, we're just seeing some very different approaches than what we're accustomed to. We're very much living, like we said, in a communication freeze. So we got to prepare for all possible options. And we're also seeing a lot of controversy over steps that are being taken that otherwise might be deemed illegal, and whether or not the courts agree or disagree with that, right? And so I think that's why we need to be prepared for these conversations. So thank you, Helen. I appreciate you coming on. We'll continue to follow this.
Sounds great.
Thanks so much.
Thank you.
Call, click, or email.